There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what are the steps to be taken to make high blood pressure normal? Answer by Whatre. How to lower your blood pressure. An unhealthy lifestyle will raise your blood pressure over time. And the higher your blood pressure becomes, the higher your risk of having a stroke or heart attack in the future. But the good news is that if you have high blood pressure, healthy changes will help to bring it down. And you don't have to wait until you have high blood pressure to make healthy lifestyle changes. The more you can reduce your blood pressure, the lower your risk of a heart attack or stroke will be. 1. Blood pressure diet. Eat less salt. Too much salt raises your blood pressure, so it is important to eat as little as possible. In fact, some people with high blood pressure may be able to avoid blood pressure medicines by cutting down on salt. Most of the salt you eat is not what you add to your food, but is in prepared foods like bread, breakfast cereals and ready meals. Don't add salt to food when cooking or at the table. When shopping for food, check the labels and choose low-salt options when you can. 2. Blood pressure diet. Eat more fruit and vegetables. Eating more fruit and vegetables helps to lower your blood pressure. Adults should eat at least 5 portions of fruit and vegetables every day. A portion is 80 grams, or roughly the size of your fist. Try to eat a range of different fruits and vegetables. Dried, frozen and tinned are fine, but watch out for added salt, sugar or fats. 3. Blood pressure diet. Keep to a healthy weight. Losing weight, if you need to, will help lower your blood pressure and reduce your risk of health problems. The best way to lose weight is to choose more low-fat and low-calorie foods, and increase your physical activity. Set yourself realistic goals. Make small changes to your eating habits and activity levels that you can keep to for life. 4. Blood pressure diet. Drink less alcohol. If you drink too much alcohol, this will raise your blood pressure over time. The current recommended limits are 14 units of alcohol a week for men and women. A unit is roughly half a pint of beer or cider, a small glass of wine, or a single pub measure of spirits. If you keep to the recommended alcohol limits, this should help keep your blood pressure down. 5. Blood pressure and exercise. Get more active. Being moderately active for 30 minutes 5 times a week can keep your heart healthy, and can lower your blood pressure. If you can't find 30 minutes in your day, increasing your activity by even a small amount can help. Think about how you can be more active in your daily life. Any activity that leaves you feeling warm and slightly out of breath is ideal. How to lower your blood pressure. Answer by Leanne Heisey. What has been done up to now? Who is looking after you medically speaking? Essentially, you need a competent doctor to look after you. Treatment-resistant hypertension according to the Dutch guidelines needs to be treated by a medical specialist, not a cardiologist, but a competent internist. Since having hypertension, even after it has been well controlled, results in more strokes and more acute myocardial infarctions, people having hypertension should not smoke. Personally, I also take low-dose aspirin because it has been shown to lower the rate of symptomatic myocardial infarctions. See the 1998 Hot study http://www.thelancet.com/journal. Am both a patient having a treatment-resistant hypertension. This means that one needs to be on more than 3 meds to control their hypertension, and a physician who has treated lots of hypertensives. Start by implementing these lifestyle modifications, taken from http://slideplayer.com/slide/473. As long as your kidney function is greater than 30%, you should start using a long-acting diuretic, Whatre. Best researched is chlorthalidone. Whatre study major outcomes in high-risk hypertensive patients randomized to angiotensin-converting enzyme inhibitor or calcium channel blocker versus diuretic. If 12.5 mg/day doesn't do the trick, add a second med. At present we prefer either a ACE inhibitor. Side effect: 1. 5% develop intractable cough, or angiotensin II receptor blocker, alternately a calcium channel blocker. Side effects mainly leg edema, beta-blocking agents only if having heart problems, angina pectoris, fast heart rates, or anxiety issues. Many people's blood pressure aren't well controlled because they aren't on a long-acting diuretic, which doesn't make you pee more if the dose was low, so no problem. Answer by Melissa Ondico. Not knowing what you have done to try and lower it on your own or anything about you. A few things you can try. 1. Lose weight. Obesity is a risk factor for hypertension. For some, weight loss is enough to lower it to normal levels. 2. Begin an exercise program. You should get clearance from your doctor as to the type of exercise they approve since you already have hypertension. Exercise raises your blood pressure while you're working out. However, walking for exercise is most likely something you say will do right now. 3. Restrict your sodium intake. Salt consumption affects blood pressure for some. Some are not salt sensitive, and reducing salt has no effect on it. Salt hides in things you would not expect to have it, but a good rule of thumb is, don't eat anything out of a can unless it is marked low sodium. Boxed snacks, no. Bread is not a low sodium food either. You have to read labels. Foods without labels, like fresh fruits and vegetables, or fresh meats, are not going to be high in sodium. First and foremost, be seen by a doctor. Unchecked hypertension can lead to stroke or kidney failure. I had a boyfriend plagued with chronic headaches. He and I were avid cyclists. He was thin, and we ate well. He had hypertension, and it was just genetic, so he had to be medicated.